is actually in the product across different doses. And when we look at that, we're finding that with a similar amount of dosing to other products, and I know you can't necessarily do cross-trial comparisons, but we've got a similar amount of dose, and we're seeing this duration profile with the same amount of dose, or a consistent amount of dose. If you then look at our cervical dystonia results that we recently published at doses that were a quarter to one half of sort of traditional doses with others, we also saw a very differentiated duration profile. And so I think that gets to the fact that it's not just, in our view, a simple dose story, and that fundamentally, in order to get sort of a different duration profile, you probably have to look at doing things a little bit differently.
Yeah. Okay. You've talked about pricing. We ask about it, and I'm not putting words in your mouth. Oftentimes, you talk about being a premium product, and when someone simple like me, who's never worked in a real organization before, looks at this, thinks, well, maybe just parity pricing with Botox with longer duration. I mean, you give no reason to not try it, but maybe you could talk about the pricing decision and its value proposition to clinicians. So the value proposition to patients and then to clinicians, and help balance those two thoughts.
Yeah, so the value proposition to patients is that if you look at the market data on the frequency of visits, so if a neuromodulator lasts 3 to 4 months, theoretically they should be coming in 3 to 4 times a year. The data doesn't support that. The data suggests that in aesthetic treatments, patients come in on average kind of 1.7 to 1.9 times a year, and that's for kind of those that are much more engaged in regular treatment. So there already exists, in our view, a large portion of the consumer population that remains undertreated that's out there. So I think the value to the consumer is make sure that whatever you're paying for, that you're getting that result for as long as possible. And when we've done our market research, that resonates for consumers that, geez, if I don't have to go in as often, but can have more of the look that I'm going for, I'm willing to pay more for it because I see real value there. And so we think that there's a good argument that the physicians can charge more for a product that delivers longer duration. And you've seen that across healthcare and other sectors where you have a product that offers a longer duration profile, you tend to get rewarded with higher economics on that. On the physician side, it's a similar value proposition that, hey, listen, if you can give the patient a better lasting effect, particularly that aligns with sort of their current frequency of visit, and you can charge more for it, why wouldn't you? I mean, you're going to have a happier patient and you're going to be able to make more money for the same unit of time. So that really resonates there. To your question about, why not price it at parity and then try and take a larger section of the market? I think you get one shot to come into the market when you've invested in fund innovation. And if you go the pricing angle too aggressively, I think you lose opportunity. And then what's to prevent competitors from saying, well, great, well, we'll now discount at 20%, right? And so now you're in that kind of spiral of making price the most important thing versus the value of the product. And hey, we've long talked about this as, a product that will help build the market, right? If you look at the overall growth dynamics in the aesthetic market, anytime innovation comes in, it's an opportunity for engagement with consumers, for bringing more people in. And I think overall, that's where the greatest opportunity exists. And, we long said that we think that most markets have some level of product differentiation and market segmentation. And we're going to, we believe, offer a new category in the long acting that will be, contributing to the growth, but will carve out a new sector.
I think you subtly hit on this, but maybe we have seen some recent entrants into the market and they've struggled a little bit. And I know you talked about taking that pricing angle, but can you talk about some of the learnings around the recent competitive launches? Evolus's out there with Juveo, obviously. Right. Things that we could learn positively from, other aspects that maybe we should seek to avoid, right, as we look at Daxi?
Yeah, well, certainly coming into the market when we do get the benefit of looking at those that have gone before us and trying to learn on, what's worked, what's not worked. I mean, the market is now matured to a point where there's a fair bit of choice, right? And so, physicians can make choices around products, price, all those things. And so that exists. I think, a couple of the takeaways, I think Evolus did a really nice job with their product of sort of finding kind of where their value proposition resonated in going after that. And I think what it did show is that even in the absence of a filler or a full suite of products, that their message resonated, right? They were able to get reasonable number of practices that were leaning in with them, that were willing to make the switch. And I think to us, what it says is, we believe this is a market that, despite sort of some of the success the competitors have had of creating bundle discounts and other things, that it's a market that's inherently curious. It wants to try new things and wants sort of the latest. And so we believe that that bodes well for us as we bring not only the RHA filler line in, but once approved our neuromodulator to get adoption. We've also said our strategy is a little bit more to go narrow and deep versus broad. So that's a little bit of a different strategy. And we've talked about not allowing advertised pricing to kind of help create this prestige or high-end category where it's ultimately the physician that's going to drive sort of that consumer pricing versus the advertised market that's going to drive it. So those are some of the lessons learned, and we've all picked from our prior backgrounds about how we think about this and what's the strategy. So we're 1 quarter in. We like the strategy. We think it's been validated, but it is early, and we'll continue to be open-minded as we evolve as well.
Now, I know you don't want anyone, especially folks like us, to get too far over our skis and expectations, but we all run surveys. I often say when surveys are run, they can be overly simplistic. We saw it with how I think some of our colleagues surveyed the potential Juveo launch. If you ask clinicians, do you want something cheaper? They just say yes. Right. And there's expectations of for some reason, a wholesale conversion. I think there needs to be a little bit of nuance, but we're doing the same thing now that we're surveying for Daxi. Right. And we're asking questions, and then we follow up with obviously the interactions with clinicians. So I'm putting it back to you. In this case, we think we're doing a good job surveying, and we're getting monster responses about what if the product really held up and the duration as we hope it to be, that there really could be significant conversion. And I don't think we're being overly simplistic in how we're approaching these surveys. So I'm maybe giving you an opportunity to either talk us down, talk us up, or give us a sense of, if we are able to have in the real world the experience that we saw in the clinical studies, what should be level of expectations a few years out?
Yeah, well, we're certainly very optimistic and encouraged by what we've seen. And I think given the different sort of duration profile, we do feel we've got an opportunity to introduce something that in a very different way, right? We've got sort of a product that today doesn't exist on the market. So we're very excited and encouraged by that. The caution I would put, or sort of the reins I would put on that is, the product's never been used outside of clinical trials. And all that says is we know that physicians like to tinker and use products a little differently. Some of them will dilute a little differently, how much product they put in different areas, their injection technique is different. And so I think the one thing that we just need to guard against is going too quickly.